Well, time now for a look at your health, and tonight we are talking about having younger looking skin without ever going under the knife. Joining me now to talk about this new procedure is Dr. William Groff from Cosmetic, or is it Cosmetic Laser Surgery?
Yes.
Okay, Dermatology, I'm sorry about that. It said Cosmic, and I'm guessing you don't do anything all that cosmic.
Not yet. That could be down the road, though.
As new as this is,
right,
and innovative.
Right, we're getting there.
All right, so this is called the Ultra Lift.
Yes.
How is it different from a facelift, and what tools are used?
Well, the big advantage is that it's non-surgical. This is something we've developed because we see patients every day that are in their 40s, 50s, 60s that want a facelift-like result, but of course they don't want to go under the knife. I mean, there's a lot of potential risks with facelift surgery, and we can get around a lot of those with this new procedure.
Well, we have a list of what the Ultra Lift treatment actually kind of targets, like facial veins around the nose, eyes, and cheeks. Talk about some of the other things. Actually, if we can put up the list, that'd be fantastic. That it smooths out wrinkles and it tightens loose skin, but how does it do these things that we're showing our viewers?
Well, basically, at our practice, we have about 40 different lasers. That's a lot. So we can use different lasers to target different levels in the skin and even deeper than the skin into the fibrous tissue. It's the same tissue that the plastic surgeon would pull on when doing a facelift. We can target our machines to heat up that layer and pull. It'll kind of pull and tighten the skin.
How many layers down is that?
Well, it depends how you count, but about 4 or 5.
Oh, that's right.
Yeah.
And so is it painful?
Well, we usually give patients light sedation when we do this type of procedure. So they're wide awake, but they're sedated. So
it's one treatment. You go and get an Ultra Lift. You don't do 6 weeks of something.
Right, and the other big advantage is when you get a facelift, say you have a lot of sun damage, brown spots, broken capillaries, well, you pull the skin back, but the skin still looks bad. So the nice thing with this procedure is you get the tightening of the facelift, but you get the surface improvement as well, which we have some photos that we might want to look at.
Yeah, definitely, because I was looking at these on my computer and these before and afters, and a lot of times I can't really with the naked eye tell a difference. These are pretty dramatic.
Thank you. I appreciate that. This is a patient that I treated just about 2 months ago, and you can see the dramatic tightening in the cheek and the jowl area. You can see this patient's about 71 years old, and I treated her. She's 1 month out in the after photo, which is the bottom photo. You can see all the wrinkle reduction around the mouth. Now, if you look... So you mentioned kind of recovery time. How are you red afterwards, or...? You can be. There is a peeling phase that you go through, and it can take anywhere, depending on the patient's age and the level of damage, it may take 5 to 7 days to kind of quote-unquote recover. Okay. But, I mean, if you look at a traditional facelift, you could be looking at being out of work for 2 or 3 weeks, and... Yeah, and I think that scares most of us laymen out here, is you see those people bundled up and you think, that looks excruciating. Yeah. And then you're worried that after all the swelling goes down, you won't look the same. So this... you need to find a doctor who knows how to do this, though. What do you recommend and the questions you should ask to make sure you find the right person to perform this? I think a couple of the most important things are finding a board-certified dermatologist. Nowadays, there's a lot of doctors that, you got maybe gynecologists and other specialties trying to do cosmetic work that don't have the same backgrounds. But more importantly, I think if I was going to have a procedure done, what would I want to do? I want to look at the doctor's work. So ask to see their before and after photos. Nothing is more telling than looking at patient after patient before and after photos and seeing what the doctor's work looks like. And real quickly, better than a facelift, about the same? I think it's better because you get all the surface improvement that you don't get with the facelift, and you get the wrinkle reduction on the upper lip, which a facelift does not address at all. All right. Thank you so much, Dr. Groff. Very interesting. Good to see you as well. Lauren, over to you.
Dr. Groff.
I'll call.
I know. Hey, I'm putting him on speed dial.